Thoracic trauma, a comprehensive approach based on advanced trauma life support guidelines. Welcome to the Everything Surgery podcast, where we delve into the critical aspects of surgical care and trauma management. In today's episode, we are focusing on thoracic trauma, guided by the principles of advanced trauma life support. Let us embark on a detailed journey through the structured methodology that underpins the treatment of chest injuries, emphasizing rapid identification and intervention for life-threatening conditions. The core philosophy of advanced trauma life support in chest injuries. The foundation of advanced trauma life support in chest trauma management is a systematic approach that prioritizes the detection and immediate treatment of injuries that threaten life. The initial assessment, structured around the sequence of airway, breathing, circulation, disability, and exposure, is designed to ensure nothing is overlooked. The guiding principle is simple: treat first what kills first. Remarkably, many dangerous chest injuries can be stabilized using straightforward procedures such as needle decompression or the placement of a chest drain, often without the need for immediate surgery. The deadly dozen. Identifying critical chest injuries. Advanced trauma life support classifies 12 life-threatening chest injuries into two categories: those that demand immediate attention during the initial assessment, and those that are typically discovered during the more thorough secondary examination. Immediately life-threatening injuries found in the initial assessment: obstruction of the airway. This may result from direct trauma to the neck or face, a fractured jaw, aspiration of blood or foreign material, or a rapidly expanding neck hematoma. Management includes basic airway maneuvers such as lifting the chin or thrusting the jaw, suctioning the airway, and securing it with an endotracheal tube. If this fails, a surgical airway may be necessary. Tension pneumothorax. This occurs when air becomes trapped in the space around the lungs, pushing the central chest structures to the opposite side and impeding blood return to the heart. Signs include severe breathing difficulty, low blood pressure, deviation of the windpipe, one-sided absence of breath sounds, and distended neck veins. This condition must be diagnosed clinically and treated instantly by inserting a large needle into the chest, followed by definitive management with a chest drain. Open pneumothorax, or sucking chest wound. A large opening in the chest wall allows air to pass through during breathing, often producing a distinct sucking sound. Management involves sealing the wound with a sterile dressing taped on three sides, creating a flutter valve effect, and placing a chest tube away from the wound before surgical closure. Massive accumulation of blood in the chest. Hemothorax. Rapid pooling of blood in the chest cavity, often from injury to major vessels, can cause low blood pressure and absent breath sounds. Immediate management includes restoring blood volume and draining the chest with a large tube. Ongoing or excessive blood loss may necessitate urgent surgery. Flail chest. Multiple rib fractures create a segment that moves paradoxically during breathing. The main danger lies in bruising of the lung tissue beneath. Treatment focuses on adequate pain relief and, if needed, assisted ventilation. Cardiac tamponade. Accumulation of blood around the heart restricts its ability to fill and pump effectively, presenting with low blood pressure, distended neck veins, and muffled heart sounds. Initial treatment is removal of the fluid with a needle, though surgical intervention may be required for definitive care. Potentially life-threatening injuries revealed in the secondary examination. Simple pneumothorax and hemothorax. These are managed by placing a chest tube, which also allows for monitoring of air leaks or ongoing blood loss. Lung bruising. Pulmonary contusion. Blunt injury to the lung tissue can worsen over time and is treated with oxygen therapy, cautious fluid administration, pain relief, and sometimes mechanical ventilation. Traumatic injury to the major chest artery. Deceleration injuries can cause tears in the major vessels of the chest, often fatal before reaching the hospital. Indicators include a wide central chest shadow on imaging and differences in blood pressure between limbs. Management includes strict blood pressure control and urgent surgical or endovascular repair. Injury to the windpipe or bronchi. Signs include a persistent air leak, ongoing collapse of the lung despite chest tube placement, and air trapped under the skin or in the central chest. Diagnosis is confirmed with a scope, and surgical repair is often required. Rupture of the diaphragm, more commonly affecting the left side. This injury may allow abdominal organs to herniate into the chest. Signs are subtle and may include the presence of a feeding tube on chest imaging. Surgical repair is necessary. Blunt injury to the heart. This results from direct force to the chest, causing bruising of the heart muscle. Signs include changes on heart monitoring and are suspected in cases of chest fractures. Management includes close monitoring and supportive care. The Advanced Trauma Life Support Algorithm for chest injuries. The initial assessment begins with securing the airway while protecting the neck, followed by a thorough evaluation of breathing. This includes observing for neck vein distension, displacement of the windpipe, and uneven chest movement, listening for reduced breath sounds, and tapping the chest to check for abnormal sounds. Immediate attention is given to conditions such as tension pneumothorax, open chest wounds, and massive blood accumulation as soon as they are identified. The circulation assessment involves checking pulses, blood pressure, and skin color, establishing intravenous access, and starting fluid replacement. Critical conditions such as massive blood accumulation and cardiac tamponade are treated immediately. The disability assessment focuses on neurological status, while complete exposure ensures that all injuries are identified without compromising warmth. Adjuncts to the initial assessment include chest imaging and ultrasound, which can rapidly confirm the presence of air or fluid in the chest and detect fluid around the heart. The secondary examination involves a head-to-toe review, further imaging with computed tomography for detailed injury definition, and planning for definitive care, which may range from ongoing monitoring to emergency surgery. Practical skills emphasized in advanced trauma life support: needle decompression for tension pneumothorax, chest drain insertion for pneumothorax, hemothorax, and combined injuries, removal of fluid from the pericardium for cardiac tamponade, application of an occlusive dressing for open chest wounds. In conclusion, the advanced trauma life support approach to chest trauma is a disciplined, prioritized system designed to identify and address life-threatening conditions within minutes. The emphasis is on clinical judgment and straightforward, life-saving procedures carried out during the initial assessment. If you found this episode informative, please like, share, and subscribe to the Everything Surgery podcast. Join us next time as we continue to dissect the extraordinary world of surgical care.